What stuck out to me was that Hopkins truly had an aura of service, humility.
The institutional and departmental focus on continually improving the safety and the quality of the healthcare that we deliver to the patients in our community.
Having a residency program that was made up of people that would embrace me and welcome me was very important. One thing that I wanted to experience was diversity.
And I am so glad that I chose a program like Hopkins where we can provide some of the greatest care to underserved populations. Mentoring and encouraging people of color, focusing on care of the underserved, so people from marginalized communities. I was pretty sure after interview day that Hopkins would be able to nurture me and help me continue to pursue these passions of mine.
I think the thing that really consolidated it for me was the people. On my interview day, I feel like everyone was truly passionate about improving and protecting women's health, and everyone I talked to was a part of the movement and determined to be a change maker.
I knew that no matter where I wanted to take my career, whether it be fellowship, whether it be a career in private practice or academics, I would have the resources, the mentors, the support, and the research to succeed in whatever career path I decided to pursue.
We have a very rich history here. Big picture, I knew that this was the place to be to make change, to assist with me making discovery, to learn, and of course to have a great time with my colleagues and my co-residents. We work very hard, but the work is worth it.
Immediately once I got to Hopkins, I knew I made the right decision by choosing to come here. I couldn't be happier with the residency program.
I've come here, I've been welcomed by everybody from faculty to residents.
My experience here has been incredible.
It's a very collaborative environment.
There is such an emphasis on teamwork and camaraderie here. The residents all have each other's back. We would sacrifice anything for each other. I feel like that really is true.
The people, the staff here, they love to teach and they're very open with open arms. So we've been very fortunate in that respect.
I also think the exposure to renowned faculty, people who are experts in fetal therapy and MFM, we get to interact with those people directly on labor and delivery on a day-to-day basis and pick their brain.
So I feel like just overall big picture, we have a lot of support from not only a mentorship standpoint, but also a research standpoint.
The mentorship and the leadership here is absolutely amazing.
They are very willing to reach out and check up on you as a person, just a person to person, human to human, not even as a colleague.
Wellness truly is of paramount importance to the program, which is really refreshing to see.
I found that the hierarchy was very flat and that I was able to approach pretty much anyone on my team.
Dr. Chow is always around. She's always got a smile on her face. She's always asking how you're doing.
She has been so wonderful, even when I'm struggling on some shifts, but she'll still want to sit with me and get to know me, and during our small breaks talk about ways to kind of hone in my interests, which are particularly in policy and advocacy.
We've really tried to highlight our curriculum, not only for, of course, pre-obs. We've really tried to focus it to more of a broader picture, looking at how does implicit bias play a role in how we as physicians practice and how we as physicians treat patients, or how do our identities affect how we treat patients.
Being able to, take care of a diverse patient population has meant so much to me, and there are so many times where I walk out of a patient experience and I'm so grateful for the opportunity to take care of women in the Baltimore area.
I think this residency spoke to me greatly because I knew going in, the patient population is very sick. By and large, we get patients from around the corner to patients who are from, international. So I knew coming in that I'd get a great education. I'd see all the zebras I need to see. I would see all the bread and butter I need to see.
But I really feel as though even as interns, we are trusted with some of these cases and we are taught how to handle these things.
We're given a lot of responsibility even as a first year. As a second year, you're taking night float as a GYN and you're by yourself. You're leveling cases, you're doing laparoscopy early, you're doing robotic cases early.
Our graduates, whether they go into generalist practice or onto fellowship, consistently feel very competent and confident in their laparoscopic and robotic surgical skills, as well as their open and their vaginal surgical skills.
No matter where you go, I feel like if you have that level of training, you can really handle anything.
Part of their mission statement is building leaders. I think, from the beginning, they're committed to doing that. And it just speaks to how invested they are in our education. I actually have been very pleasantly surprised by the city.
They call it Charm City for a reason. It really has such a homey feel to it and has so much more to it than meets the eye.
I've always felt very safe. I really enjoy where I live in Harbor East. I feel like the harbor is beautiful.
When I came and interviewed in Baltimore, I was surprised at the city that I found, and I absolutely fell in love with it.
I've enjoyed the good eats and COVID-friendly spaces. I feel like there's truly every type of cuisine. It's a very lively, manageable city, very good cost of living. I'm like overall very, very happy with my living space and my quality of life here.
I grew up in Maryland. I decided to stay in Baltimore for residency because I truly do love the city.
It's a great local community. Just a 20 or 30 minute drive outside of the city are a bunch of lakes, rivers, state parks, and national forests, which are great to go hiking. It's about 3 hours by train or drive from New York. It's about an hour from Philadelphia and about an hour from DC.
This is really a time to like let yourself shine and let yourself speak through the screen.
This residency process is very, very stressful, but I would trust the process as much as you can.
It boils down to that gut feeling. I know it sounds very cliche, but that gut feeling has proved to be true for me and proved to work out.
Try to, as much as you can, just take a minute, look at all that you've done these past few years, because you've been working very hard. So just enjoy it, be yourself, do the research, ask the questions that you want to know about us, and go from there.